is not as difficult as it may seem. Yes, it just requires systematic approach. It is still the same thing you and I knows. When we say something is aseptic non-touch, it does mean that we need to handle it with utmost care so that we don't unduly introduce microorganism into the sterile field. It is a sterile procedure and it should be handled as so. ANTT, that is Aseptic Non Touch Technique, is one of the worst nightmare that most OSCE candidates is faced with. And what about this station? It is not as difficult as it may seem. Yes, even during the time I wrote my own exam, it was ANTT that I was faced with. Yes, it is not difficult at all. It just requires systematic approach. It is still the same thing you and I knows. When we say something is aseptic non-touch, it does mean that we need to handle it with utmost care so that we don't unduly introduce microorganism into the sterile field. It is a sterile procedure and it should be handled as so. When you are told by the assessor that the trolley has been cleaned and disinfected in the last 24 hours, you're going to go ahead and put on your apron and a pair of gloves. Then you right there is going to be a cubicle. It is you and the assessor in a cubicle. So everything you need for that station will be made available for you right there. So pick a cleaner wipe. You start verbalizing the validity of equipment right from your cleaner wipe. All right, pick a piece of cleaner wipe. Then anything you do in this station, you must verbalize. Even in every of your OSCE station, anything you do, you must verbalize because failure to say it will be tagged as you have not done it. All right. So what does it mean? So in this station, it's going to be paired with assessments of wound. Okay, you're going to assess the wound, which is about 6 minutes. Yeah, 6 minute station, as well as to carry out the dressing. All right. So the dressing is about 15 minutes long. So the assessment and the dressing together, it's about 21 minutes, which is quite much to demonstrate your skill in this station. Your assessments, you're not going to be saying much in assessing the patient's wound. So that's 6 minutes. It will be wise of you to carry out your assessment in about 2 minutes 30 seconds, which is possible. Yeah. So the rest of the minutes, you can save it up and use it to carry out your ANTT. All right. So without further ado, let's dive into it. So just like other skill station, what is expected of you to do here with the scene safety, the ID check and all of that is still the same. You're going to do it the same way here. So having done that, in your exam, you are not going to be given a real wound. It's going to be pictorial illustration. Okay, so you're going to be given a picture demonstrating what kind of wound it may be. It could be terrible wound and it could be clean wound. Please do not be scripted. Act according to whatever you are seeing on the picture. Yes, this is important. There is an acronym to enable you to properly assess the patient's wound, which is the TIMES. Right, TIMES. The T is the tissue surrounding the wound. I is check for any signs of infection. M is the wound dry or there is accumulation of exudate. All right. E is the edges of the wound. Is it bad? Is there maceration? Is there laceration? You describe that. S is the sutures. All right. Are the sutures, are they aligned? Is there dehiscence? Is the wound well opposed? So all of these things should not take you more than 20 minutes, 30 seconds. Yes. And the remaining minutes, when you are done, you don't necessarily need to wear PPE to carry out the assessment. Yes, when you are done, perform your hand hygiene following the 7 steps of WHO standard. Hand over call bell to the patient, then step aside. Here is where the real business lies. And this makes it to be like as if it's something so enormous. It is not. Yes, when you step aside, confirm with your assessor. Assessor, could you please confirm the trolley has been cleaned in the last 24 hours? And the assessor will tell you yes. Do not be limited to that. Yes, as soon as you get a yes from assessor, step aside to wear your apron, pick a pair of gloves. Also, the clean air wipe you're going to use, this is where the real talking starts. From clean air wipe till you finish this station, you will be talking. Yeah, it requires you to talk a lot in this station. Pick a piece of clean air wipe, clean the top of the shelf first, from farther to nearest, all right, in zigzag manner. We verbalize this, including the rails, all right. Then discard that, pick another piece of clean air wipe, clean, do the same, repeat the same procedure to the bottom shelf trolley, including the side bars, right? Discard that, remove your PPE, including your glove, perform your hand hygiene, the discard the used PPE, then perform your hand hygiene. Yes, then you proceed to gathering of your equipment. What are the equipment you are going to gather in this station? Some school of thought will say 7, some will say 6, but I would say you're gathering just 5. And what are they? The first one is your dressing pack. The second one is the dressing itself. They call it dressing here in the UK. The one you use to just to put on the wound directly after you might have cleaned it. So it's the dressing. The third one is the normal saline. Okay, that's the sachet. Fourth equipment is the chlorhexidine 70% alcohol-based wipe. All right. The fifth one is your apron. Right. So you're going to put the apron right there. And all of these equipment you're gathering should be on the bottom shelf of the trolley. Mind you, should not be on the top. Putting those equipment on the top shelf trolley could be critical. And as soon as you are done cleaning the trolley, you should hold it by the middle rail. Okay. After gathering all of your equipment now, you proceed to your patient. All right. Tell them you are back if he or she is still willing for you to proceed. Right. Having done that, you're going to pick your apron and wear it systematically, stepping few centimeter backward from the field. Right, wear your apron. Do not flap the apron so that you don't introduce any germs to the field. Having done that, you carefully pick your dressing pack. You're picking that first. Then, stepping backward few centimeter from the field, peel open the pack, the dressing pack, tip the pack onto the trolley, then put the pack, the empty sachet, on the bottom shelf trolley. Having opened the pack now, you know you've touched outside, you want to touch the inner now, which is much more sterile. You've touched the outer covering now. So you go ahead and perform your hand hygiene, following the 7 steps of WHO standard. You cannot overperform hand hygiene in this station, but you can underdo it, mind you. So you're going to open the sterile pack now. Holding the tip, there will be envelope corners that is folded little by little. Right, you hold the tip and open the pack away from you. Open it that way while you are on the spot. You don't need to travel about around the field. No, on that spot, you're going to be reaching your farther. You open the field away from you, all of those corners, till you can access the park itself. There's not going to be too many equipment in the, so that it's not going to be too clumsy. No, you will have a receiver, 2 pieces clothing to drape your patient, right? So it's important you, and probably the gauze, some pieces of gauze, and which other thing, I think that's basically it. So it's not going to be too clumsy and you'll be scared. No, there won't be forceps and all of that on the field. No. So having opened your sterile pack now, you perform your hand hygiene again, following the 7 steps of WHO standard. You pick your orange bag next. You use your index and your thumb to carefully pinch hold. You pinch hold the orange bag with your dominant hand. Take a few steps backward the field. Right, hand over the pinched held bag to your non-dominant hand. All right, it has been folded in layers, so you don't need to be bothered whether or not I'm holding. Just pinch hold the first layer. All right, so by the time you hold it that way, already you will see opening. Should have opened like about percent way through. Then carefully maneuver your right hand, your dominant hand. It could be your dominant hand now. Yeah, you carefully maneuver your dominant hand into the sterile bag and hold it in place. Your left hand, your left hand should hold the bag in place. So you use that hand to rearrange your field. Yeah, having done that, you step a little backward from the field and invert the bag. Yeah, you invert the bag, turn it inside out. Yes, you will see a seal tape. There will be a seal tape. You peel the seal tape, then you attach the bag firmly to the side of the trolley. That becomes your new garbage. Having done that, now you perform your hand hygiene following the 7 step of WHO standard. The next thing you want to do is to pick your saline, the sachet of saline with a chlorhexidine, a 70% alcohol wipe. You wipe the sachet from top to bottom. Yeah, then you peel it open. You see the sterile marking on it. You peel it open and empty the content into the receiver that is already on the field. Please do not forget, while gathering your equipment, you need to validate their in date. That's key to every station, please. Yeah, empty the sachet into the receiver there on the field. Then you dispose the empty sachet into the garbage. Yeah, so having done that now, you're going to perform your hand hygiene again, following the 7 steps of WHO standard. Then you pick the dressing itself, peel open the dressing and invert it onto the field. Yeah, discard the outer covering into the garbage also. So having done that, you're going to perform your hand hygiene again, following the 7 steps of WHO standard. Now, you want to go and wear your sterile glove now, which is critical. It shouldn't take you so long, and it's easy. It's quite easy. Now, the glove has been folded in a way that it shouldn't stress you to wear. Put your hand into that, into the folded part, then maneuver your dominant hand first. So it's going to be your dominant hand is already sterile, so sterile will touch sterile. You wear it, let the sterile touch the sterile part. Now your hand, still the envelope corner, but the sterile is now sterile to sterile. Where it's, however, it is easy for you, then you can adjust, because the two ends, when your fingers, at least 3 of it has entered, you can adjust with this one, this other hand that is already sterile. That shouldn't stress you. If you know that you're struggling too much and your clock is tickling down, assessor can help you that if you can still continue, even while your hand is not, you can still maneuver your way through. That will not be a problem. All right. It is important to not to forget to drape your patient. Now that you have sterile hand, you are on your sterile field. Yeah. The next thing is to drape your patient. Some school of thought will have it that you should place the drape underneath the place you're going to carry on the dressing. But I would strongly advise that you should hold the drape carefully and put it distal proximity to where you're going to clean, right, on it, because your hand is less likely to touch the tongue as quickly as it will touch the top. So when you put it distal, very close, not too far away from where you are dressing, even if your hand mistakenly touch any part close to the place you're dressing, you can still know that it's still sterile, touching sterile. So I would advise that you should place the drape close on top and not on the bottom. Yeah. And one of the drapes is okay. Yeah. You might not necessarily use the two to save you of your time. Yeah. Another important step is you no longer verbalize clean or dirty hand. Yeah, while carrying out your ANTT. Yeah, what will you do instead? You've got 2 hands, isn't it? So you just say, okay, I'm going to be transferring the gauze now from the hand that is on the field to the hand that does the cleaning. That is as simple as that. Yeah, that's still perfect. So you're going to, your dominant hand, pick a piece of gauze, put it in the saline, bring out the excess, then pass. Some people will say you should drop it onto your palm, whichever way you want to do it. But I would strongly advise you pass it side to side, making sure your two ends does not contact. Pick the from your dominant hand, then receive it side to side. Yeah, side to side, the side, making sure your two ends does not contact. Because in the process of dropping it this way, it may fall if you are not that smart. Okay, then you do the dressing in a single stroke and you discard that into your garbage. Do that twice, most twice, so that you could over clean the wound too. Yeah, so do it twice in the same manner, single stroke, discard into the garbage bin. Yeah, then pat dry the wound in the same manner. Yeah, just twice is okay. Now you are done dressing the wound and you've pat it dry. Now is to pick your dressing itself to cover the wound. All right. So the dressing itself has got two covering. The first one was the one you removed when you inverted the pack onto the field. Now the one it has got now, before you get to the sterile part of the most sterile part of the dressing, now you're going to peel open with your two ends, making sure all of this thing you are doing, you are verbalizing to the assessor, because assessor will not assume for you. I'm going to peel open the dressing now, making sure my ends does not contact the most sterile part. So the one that your hand that is on the field should hold the longest part, while the one on the sterile field should hold the shorter part. Then you carefully place it in ensuring there is minimal crease while you place the dressing. All of these things should not take so much of your time, and you should not be so extra careful in order for you not to make mistakes. When you are becoming too careful, that is when you can run into errors. All right. So when you are done placing the dressing, then you use your hand to pick the drape, pack everything underneath the bottom shelf, put everything on the top shelf on the dressing pack. Then wrap everything, put it in the garbage, the orange bag. It could be any color, do not be scripted. In case you did not see orange bag in your exam and you became frightened, oh, why is it this color? It could be any color, all right? So put everything into the garbage, all right? Then wrap it, expel air from it, wrap it now and take it into the main garbage. Then remove your PPE, which is key. Stabilize to the assessor, you are going to clean the trolley and prepare it for the next use. Then you're not going to document anything in this station, mind you. Go ahead and perform your final hand hygiene. You have successfully completed ANTT. So tell me what is difficult in this station. If you have any concern, drop it down there in the comment section. Until I come your way in my subsequent videos, keep practicing OSCE. Bye.